think that most nurses go into nursing for a similar reason to mine, which is just the desire to be present and care for other people. And you know, as hokey as that might sound, I think it's a very genuine feeling in a lot of people.
I decided to become a nurse because there had been health issues and illness in my early growing up years. I think that was under there, and it inspired me to want to feel like I could somehow bring care to people.
The truth is, I really don't remember ever not wanting to be a nurse. So from the youngest I can imagine, I always wanted to help people feel better. Nursing really was high touch, low tech in the 60s and 70s when I started. And over time, nursing became more high-tech, low-touch, and I think nurses aren't really even taught about touch therapy or massage now. So over time, working in an intensive care most of my life, it really became more high-tech, and it, as much as I knew I was helping people feel better, it really was, you know, gradually less satisfying.
When I left bedside nursing, I went into a different kind of nursing that was more chart review. I missed the touch so much, and I realized that that was really something that I needed to have back in my life.
I was diagnosed with MS. A couple of people offered me some actually different kinds of energy work, and I accepted and received them and found the experience incredibly profound. And I can remember sitting on the table in the doctor's office, literally my whole body was shaking with fear. And I went from that to feeling an incredible peace and calm and certainty. The combination of my personal experience and my job as a nurse, it just completely opened up. It was sort of like, what are you waiting for? I think that symptoms are not always meant to be eliminated, but to be responded to. And whether that be physical pain or, you know, emotional anguish, we have feelings, physical and emotional feelings, for a reason. They inform us and they tell us about ourselves.
Disease is mind, body, and spirit, and so we can't just treat the body, which we're very good at, and necessarily so in Western medicine. But there's this whole other part to us that also needs to be treated. It's poignantly said by patients, one patient who said, pain medication does nothing for the pain in my soul.
Most people, if they think about being comforted as a child, it involves touch, and that's so primal and real, and we get away from it as we move into adulthood. I think we have a very sexualized culture, and yet we're not really comfortable with really recognizing how important touch is. I had a boy come into me the other day. He had a headache, and I said, do you know, sit down, and do you want me to put my hands on your head? And he said, sure. So, you know, it was maybe 4 minutes altogether. He got up and he's like, wow, I feel so much better. And I said, that is so great. I don't expect that. I don't assume anything. I know that that was a good thing for that moment.
The hardest part about studying integrative medicine therapies is that the preferred studies are double-blind, and you know, it's, if you had a medication you wanted to try out, it would be easy to give one person the medication and one person a placebo pill, and neither would necessarily know which they were getting, and even the physician doing the study might not know which one they were getting till the end of the study. So it's easy to really have the control group and the the intervention group and have it be double-blinded. With integrative therapies, it's harder to do that because it's real obvious to the person whether they're getting massage or not.
There's a couple of schools of thought as to what integrative care is for someone that might not feel receptive to it. And one is to say it's a placebo effect. And the placebo effect is an extraordinary phenomenon. And what it says is that the mind has an effect on how the body responds. So let's use that. The body's a pharmacy, and we have a thought, and we will release chemicals that will respond to that, and it does affect illness as well as wellness. Doesn't mean it's nothing. It means that the mind is being triggered.
After the work, I don't think I've ever had somebody say they didn't feel better. Like most people say, I feel better. Something feels better. I don't know what it is. And they'll kind of look at me like, well, I don't know why I feel better. Like as if, and I don't even try to answer that question because it's their experience, and the important thing is that they are feeling that. It's almost like a good night's sleep. You know when you feel better, you know when you feel good.